Thank you, organizers, for giving me this opportunity. Good afternoon, everyone. So my topic is prognostic factors for relapse in patients with clinical stage 1 testicular seminoma. It's a nationwide population-based cohort study. It's a Danish study. Seminoma is one of the most common cancers in the age group of 15 to 45 years of age. It is diagnosed in almost stage 1 in 50% of patients in Danish registry. The 5-year relapse rate in multiple study being 13 to 20%. The high risk factors which has been documented are tumor size of more than 4 centimeters and retinal invasion. And these are present in various guidelines. These prognostic factors may be problematic because there are variably selected study populations, variable pathology reporting, and substantial amount of missing that data and limited statistical power. So the method of the study was, this is a population-based cohort study, and patients with clinical stage 1 seminoma diagnosed between January 2013 to December 2018 were identified in prospective Danish testicular cancer database. In Denmark, what they do is all stage 1 seminoma are observed. There is no treatment given. So by linking Danish National Pathology Registry to the histological site from orchidectomy specimens were retrieved and reviewed blindedly by 3 pathologists who were blinded for the clinical outcomes. Follow-up of information was updated till July 2022. Statistical analysis was done by the association between the pre-specified potential clinical and histopathological prognostic factor, and relapse was assessed by Cox regression analysis. A total of 924 patients were identified of stage 1 seminoma, which were observed. 16% patients out of 924 patients, 148 patients had relapse with a median follow-up of 6.3 years. The 5-year overall survival was 97%. These are the baseline characteristics of stage 1 seminoma patients, which were present in the Danish registry. The median age was 40 years. The pre-orchidectomy beta-HCG elevation was normal in almost 70% patients, and it was elevated or unknown in almost 30% patients. LDH was normal in almost 60% patients, was elevated in almost 38% patients. These are the various histopathological factors present, and which were markers for prognosis or relapse. Out of all those clinical and histopathological factors, there were 4 factors which were identified in final multivariate Cox model for relapse, which was first was testicular hilum invasion, which involves both retinal invasion and invasion of hilar soft tissue with a hazard ratio 1.81 and 2.83 respectively. Lymphovascular invasion was again a significant hazard risk of about 1.82. Beta-HCG elevation, the hazard risk was 1.89. LDH elevation had a hazard risk of, and these beta-HCG and LDHs was pre-orchidectomy levels of beta-HCG and LDH. This is the 5-year cumulative risk of different risk factors, where the cumulative association of all those 4 risk factors, elevated pre-orchidectomy, LDH, beta-HCG, lymphovascular invasion or testicular hilum invasion, which include both soft tissue as well as retinal invasion, and the risk ranged from 0.6% when there is no risk factor to almost 62% when all 4 or rather 5 risk factors are present. This is a cumulative risk-free survival with 0 to 5 risk factors. We can see as the number of risk factors increase, the chances of relapse increases. And this is a calibration plot with the predicted versus observed. The line should be straight, but the actual point is 0.72. So discussing the study identifies this invasion of testicular hilum, which include both retinal and hilar soft tissue, lymphovascular invasion, and elevation of LDH and beta-HCG are independent predictor of relapse, with a 5-year risk increasing from 6% in patients with no risk factor to almost 62% in patients with all 4 risk factors. So this study provides prognostic factor which can be easily incorporated in routine clinical practice and can be used in further studies and follow-up and treatment strategies. Thank you.